Hi guys, how are you? So globally, millions are actually struggling with kidney condition, and unfortunately most do not even know that they are struggling with it. So in this particular video, the registered dietitian that is passionate about metabolic health, I am going to talk about why there is an increase in these kidney conditions, and also going to talk about very simple strategies that will actually help you protect your kidneys against damage effectively. So make sure that you stay subscribed. My name is Mumina. Join the community and get notified every week when I upload a video. So let's talk about why they rise. So of course there is something that we cannot all ignore. Things have changed. The way we were living in the past, the foods that we were eating, the movements have significantly changed. There is more and increased access to processed and refined food, highly refined with a lot of additives like sugar, salt, preservatives, and all these actually affect the detoxification system that is basically compromised of the kidneys. We also have a lot of changing trends in the way we are moving physically. Like the way I am moving currently is significantly lower compared to how I was moving in 2017, because accessibility and acceptability of bodas and tuk-tuks is on the rise in the country, and we have everyone, even people who are not using them prior, actually now accepting that they are there and they are using them. So people are walking less, and this has led to increase in conditions like metabolic disorders, like diabetes, hypertension, and all these actually increase risk factors to conditions like kidney diseases and failure. Of course, there's also the aspect of chronic conditions like HIV. It has been around for a while, so there's that continuous use of medication. There are strategies to actually help in ensuring that we are supporting our kidney function in people living with HIV and AIDS. Anytime you go for your refills, it is also very wise that you actually talk to your physician or even your doctor about how to protect your kidneys as a person or as an individual living with HIV and AIDS. And of course, there is the aging population, like currently with better treatments and better health outcomes, so people are living longer. And of course there's that aspect of the degenerative metabolic condition that comes with aging, and the kidneys are definitely affected. The higher the number of the aging population, the higher the risk of developing or having kidney conditions in our population. And we also have the last factor that is very serious about lack of awareness. Most people do not even understand or even know about the need to actually take care of their health, to actually get proper diagnosis or early diagnosis, checkups here and there when it comes to kidney functions. Unfortunately, kidney injury or kidney failure can be asymptomatic for many, and we're going to talk about some of the signs and symptoms later, so make sure that you stay subscribed. But for majority, it is usually silent. Like the condition will eat you up. By the time you're actually getting diagnosed for a kidney condition, it has already progressed to either late stage or severe chronic kidney condition. So let's talk about some of the solutions that I recommend as a professional and as a dietitian. So the first thing that you need to do, of course, is make sure that you are taking care of your metabolic health. You need to make sure that you apply strategies that are going to help you control your blood sugars, control your blood pressure, because unfortunately these are some of the leading causes of kidney diseases or kidney failures globally. Same thing applies to metabolic disorders like obesity. So if you have anything that is actually altering the way your body metabolizes, excretes, and even utilizes nutrients, you're definitely at an increased risk of developing conditions like kidney disease. So you need to make sure that you're putting up measures like taking care of your diet, ensuring that your diet is rich in fruits and vegetables, promoting proper hydration. Again, with kidney condition, if you are at risk, it is very important that again you talk to your dietitian and to your physician about your fluid needs, because they vary depending on the severity of the injury or the staging of the condition. Also need to make sure that you're moving, you're physically active. You know, there's that direct relationship between insulin sensitivity or blood sugar control and physical movement. The same thing applies to blood pressure. If you're doing targeted, well-planned or well-executed movements for like 30 minutes a day, every other day for like 5 or 6 days a week, you're definitely at a better position to actually control your blood sugars or even blood pressure than someone who is not. You can do cardio, easy cardio for your heart. You can also incorporate things like physical weights or even weight movement, and all these will actually help you manage and control your blood sugars better. And of course there's also the aspect of stress. I have talked about hypertension and blood sugar being a risk factor of developing chronic kidney diseases, and we all understand that there's a direct relationship between developing hypertension, that is blood pressure, and stress. Taking initiatives like journaling, I started them earlier and then I went off and now I'm back. So let's journal, let's talk about our frustrations. Let's not allow them to build up so that they can cause us issues like blood sugar irregularities, blood pressure, and kidney diseases. You can also do meditation. You can go for walks. I like going for walks. You can be joining me every day for 30 minutes. I go for a walk. I even go and just sit down and just reflect about my life. You can also start practicing gratitude. These are very direct link between relaxation and being grateful. Every time that you have a worry or something that is really worrying you or disturbing your brain, you're trying to figure out a problem and nothing seems to work, try as much as you can to look for something to be grateful in the midst of all that confusion. This will actually help you now change your perspective, and with gratitude you'll be more calm and you're definitely going to find a solution better because you'll stop capitalizing on the worry and start thinking about the solutions. And of course, you need to make sure that you are frequently checking up on your kidneys. I talked about hydration, so make sure that you're hydrating because it's very important. It's a core aspect of managing and preventing metabolic conditions like kidney diseases. And you need to also make sure that you avoid the non-prescribed medication, the things that we are used to over-the-counter antibiotics. Anytime you get like a small flu, you go and buy amoxicillin. Anytime you feel like you have a small headache, maramoja action, you need to tone down on those because there's a direct link between overconsumption of those medications and prescribed medication and kidney injury. If a medication is not necessary, it is not important for you to take it. The same thing applies to supplementation. It's also very important to ensure that you're taking guided supplementation that is necessary and that your body can actually support metabolism or excretion of the excesses or the toxins that it doesn't require. And the same thing applies to herbal remedies because I recommend intake of things like wheatgrass, the natural organic ones, but you're not going to overuse them. We're going to actually use them with caution and with guidance, and you're definitely going to get better outcomes. So thank you so much for watching. Make sure that you stay subscribed because you're going to talk about some of the signs and symptoms that you can actually look out for. And in this series, I will also be talking about some of the foods that you need to incorporate into your day-to-day routine to actually help you protect and promote your kidney function. So make sure that you stay subscribed, and I will